Okay, so I studied massage, and the title is Immediate Massage Stimulates Muscle Regeneration, Angiogenesis, and Decreases Fibrosis After Muscle Injury at the Stem Cell Research Center in Pittsburgh. My supervisors, Dr. Heward and Dr. Bess. So we're going to describe the 4 stages of muscle healing after injury and describe some therapies by stage, explain some basic properties of muscle stem cells, and summarize some previous animal studies on massage therapy and the role of the present study. So muscle injury is a common problem in sports medicine and general rehab hospitals and is often hindered by the development of fibrosis. So here's a basic structure of a muscle and a cross-section. And let's see, here in blue you can see fibrosis, and it competes with the functional muscle units here in red for a cross-sectional area, and that results in some of the decreased functional recovery and the rate of re-injury. So that's at the crux of muscle injury. So massage is a popular treatment modality for muscle injury, comprising up to 45% of sport physiotherapy. However, it's been practiced for millennia, but the exact mechanisms of massage remain unknown. Despite favorable, patient testimony, the evidence is inconsistent about decreasing clinical symptoms. So we propose that optimal massage parameters exist, which restore the long-term physiological properties of muscle tissue. So the 4 stages of muscle healing, degeneration happens early, followed by inflammation, which is where macrophages remove necrotic tissue. And then this is followed by muscle-derived stem cells, reparative cells, infiltrate. This process here peaks around 2 weeks. And finally, fibrosis, characterized by transforming growth factor beta-1, which actually coaxes muscle stem cells into fibroblasts, resulting in deposition of collagen. And although this process peaks at 4 weeks, collagen type 1 and 3 have been noted as early as 3 days. So you can treat based on stage, RICE therapy for inflammation, for regeneration, there's possible stem cell, gene therapy, growth factors, and fibrosis, anti-fibrotic agents have been well studied in our lab, and losartan, sermine, Vicrin, relaxin. But so massage has been implicated to modulate inflammation, but we also believe it affects time points 2, 3, and 4. That is, it stimulates regeneration, angiogenesis, and decreases fibrosis. And that's really the role of the present study. So why do we believe that? So we looked at the role of vascularity in skeletal muscle, and we compared the soleus muscle to the TA muscle in 8-week-old mice. And we found that, so the soleus muscle contains more blood vessels. Here you see more CD31 positive cells. That's an endothelial marker, as you'd find in blood vessels. So soleus muscle contains both fast and slow twitch muscle fibers, compared to TA, which is predominantly fast twitch. And when we injured them with cardiotoxin injury, and after 5 days, we noticed increased regenerating myofibers in the soleus muscle compared to the TA, and also decreased fibrosis. So there's something important about the vascularity. And so furthermore, muscle-derived stem cells appear to be derived from blood vessel walls. So the question really is, how can we stimulate angiogenesis? And it turns out common physical therapy modalities increase angiogenesis. For instance, Annex et al. Showed that neuromuscular electrical stimulation upregulated VEGF expression in rats. Treadmill running increases angiogenesis, shown by green, and then also in our lab where we did a contusion injury of 10 wild-type adult mice and made them run on a treadmill for an hour. And after 8 days, we noticed that the treadmill group had more CD31 positive fibers and decreased fibrosis. So what about massage? Well, the crucial result came from this paper published by our lab, in which Sarah Beckman coated muscle stem cells here on this flexible petri dish. It stretches over the course of 24 hours in a sine wave. And what we found is that, what she found was that it increased the secretion of VEGF twofold. So it seems that mechanical stimulation increases VEGF expression in muscle stem cells. And so if mechanical stretching stimulates muscle stem cells to secrete VEGF in vitro, then perhaps massage is just stimulating the endogenous muscle stem cells to secrete VEGF. So that brings us to our experiment. We looked at 4 New Zealand rabbits, and we injured the TA muscle by eccentric exercise. 7 sets of 10 lengthening contractions. And here, this is the device we use. I have a video. All right. And 100 milliseconds before this planar flexes, we actually simulate the muscle. So it's being contracted during the extension. Right there. So that this method of muscle injury was described by our colleagues Butterfield et al. In this paper, and they found that it causes reproducible muscle damage of 70% loss of peak torque within 5 minutes. So, so here's how we did a massage using this engineering device, which actually can apply a very accurate force to the loading tip of 10 newtons. We used these parameters, 5 hertz, 10 newtons for 15 minutes. Because that was described by our colleagues Hassedal in this paper. And there they found that a 10 Newton force is superior to the less force, the higher frequency superior to the 0.25 hertz, and that the duration didn't matter. Furthermore, we earlier showed that 4 consecutive days gives you more than 90% of the benefits of recovery. So here's the massage. And it's mimicking the effleurage stroke of Swedish massage. So although we used a robot, the rabbits actually prefer the Swedish masseuse. So we did 4 days of massage, 24 hours rest in between, and then harvested the tissue. But notice that we stratified when the massage began, because we wanted to analyze when is the time to start massage. So 48-hour delay, 24-hour delay, or immediately. So when we broke up the tissue into a non-massage portion, a massage portion, and then also we harvested the contralateral leg. So for muscle regeneration, we stained with H&E, looked at 5 non-overlapping segments, and counted the centronucleated fibers, so, which is a sign of regenerating a muscle fiber. So here's the control leg, and you can see all the nuclei are here in the periphery. And the borders are well demarcated. Compared to the injured non-massage portion, you can see some cellular infiltrates and maybe some regenerating fibers. And then finally, the injured massage portion, you can see clearly, regenerating myofiber and nice cell boundaries. So in the quantification, you can see that here's the massage group in red, and it had an increase in percentage of regenerating myofibers with all the massage courses. So we further believe that because of the proximity of the non-massage portion to the massage portion, that it's likely benefiting from paracrine effects from the massaged portion. So for angiogenesis, we took a look at, we used CD31, the cell marker for endothelial cells, and then determined the location of those relative to dystrophin. And we assessed the percent increase by normalizing with respect to the contralateral control leg. So here's for the massage group, these are CD31 positive cells compared to the non-massage group. And you can see an increase. And then here's when you stain it with dystrophin, and these are CD31 positive blood vessels. So in the quantification, what we saw is that, again, angiogenesis seems to be, benefited from massage in all the groups that had an increase. And furthermore, the massage seems to be most effective the sooner you started after muscle injury, and with subsequent decreases the longer you wait. And for fibrosis formation, we use Massimo's tricone staining and digitally image the sections and compare the blue pixels, collagen, to the overall area. So for immediate massage, this is the control leg, and you can see here in blue, fibrosis. And then here's the massage group, and they actually look pretty similar versus the injured non-massage portion, and you can see a significant increase. So in the quantification, indeed, what you see is that the injured non-massage portion, the massage brought the levels of fibrosis almost down to baseline. So in summary, of those results, the regeneration seems to benefit from all the different massage regimens. And then furthermore, immediate was significantly benefited by the angiogenesis had the most effect immediately, and then fibrosis. So this is consistent with previous results where our colleagues measured tissue edema and found that the immediate massage had decreased tissue web weight, decreased myofiber damage, and decreased inflammatory cells. And this is described here as well. So here you can see decreased infiltrating leukocytes, subcellular infiltrates, and then decreased torn fibers after massage. And then here's some functional analysis. And what they found was that peak torque angle after eccentric exercise, it shifts to the right. That's typical. So here, after the exercise, it shifted rightward 4 degrees. And if you do nothing for 4 days, it actually worsens to 6 degrees. But massage for 4 days, shifted it backwards to the left to only 1.5 rightward shifts. So showing that it restores some of the functional and physiological norms of healthy tissue. So for future, we plan to expand the study to more animals, and our study suggests using the immediate massage group for the larger study. Although the mechanism of massage is unknown, our unifying hypothesis is that it simulates VEGF secretion by mechanically stimulating endogenous muscle stem cells, because those are all actions of VEGF, muscle regeneration, angiogenesis, and decreased fibrosis. So future experiments are planned to further support this hypothesis using gene therapy and VEGF antagonists. So in conclusion, immediate massage after injury increases the percentage of regenerating muscle fibers and promotes angiogenesis, decreases fibrosis. We showed this by H&E stain, by immunofluorescence for CD31, and noting that it's most effective immediately after injury, and by mast-cell trichrome staining. These findings are consistent with earlier results in functional tests and provide a biological explanation for massage. So I'd like to thank AAP Board of Trustees, Electrode Store, my colleagues and mentors, especially Dr. Heward, and my family. Yes?
In regard to your CD31 staining, did you have a baseline CD31 stain for just eccentric loading? And did you ever compare that to isotonic or isometric before the massage therapy?
Yeah, we do have that. In this one, you're right, the control leg was actually it was not injured. So and that helped finding a baseline to show the increase for the non-massage portions. But you're right, I think that would be great in differentiating the difference between the injured massage portion and the injured non-massage portion. Having a control leg, that doesn't benefit from the paracrine factors.
Quick question.
Yes.
So you're talking about massage in a very undefined term. However, the rabbits were getting a specific type of massage.
Correct.
I wonder, can you just rub and is that enough, or what is the specificity of the massage?
Right. So there are tons of there are a bunch of different types of massage. I think Swedish massage is the one that's most frequently performed, and so that was one reason for us picking this one. And to stimulate some of the muscle stem cells and mechanically stretch them, I think you will need a deeper massage. You can, if you wanted to, you could scale the magnitude. We use 10 newtons for a rabbit muscle. Assuming lean muscle weight for a human, you could amplify that and use that as your baseline for how much force to apply. But of course, that would have to be validated in humans.
In other words, do you have any control?
Sorry, what was the question?
Do you have control the massage here or not?
The control. Oh, so yeah, we do want to add a non-injured massage control, right? We had an injured we had an injured non-massage control. Yes.
Thanks very much for a very nice presentation. Now, I know you have to harvest the muscle, but have you thought about doing mechanical measurements after the massage? If you have a morphology, I think you need the functional testing to show that the new muscle is actually working well.
Right. Yeah, that's.
Quite a different study design for the future.
Oh, sure, absolutely. Yeah, we've focused on some of the histology, some of the biochemical techniques, but our colleagues, and Thomas Best, they have a nice series of paper studying the biomechanical viscoelastic properties of muscle tissue, showing that they tested 21 joint angles and found that immediate massage using this regimen restores some of the functional characteristics, the peak isometric, the torque anyways, at 21 different joint angles. And furthermore, they even studied it kind of like how you said, as just a piece of tissue, and then looked at the viscoelastic properties. It's done all in their biomechanics lab. So. Yes.
For how long did you have to sustain each massage? How many days did you have?
Right. So the massage was carried out for 15 minutes, and then the motion back and forth was 0.5 hertz. There was 24 hours rest in between each massage. So 15 bouts of massage over the course of 4 days, separated by 24 hours of rest.